Welcome to Friday's edition of COVID-19. According to one study published in The Lancet, over 1 million children across the globe, that is, may have been orphaned by the pandemic. Now, we have more on this reality later on the program. We start now with the broader pandemic coverage with our Kwon So-ah. Now, so let's begin with the COVID-19 numbers for Korea on this Friday.
Right, Sunny. We are seeing a drop in infections on this last day of the work week. 1,709 cases were tallied as of 12 a.m. and that includes 1,675 domestic transmissions, and the number of imported cases remains unchanged from the day before at 34. So with that, Korea has accumulated 257,110 COVID-19 cases with a death toll at 2,308. Now, there has been a positive development not only in the drop compared to yesterday, but also compared to last week. We are seeing an on-week decline from over 1,800 cases reported last Friday. Now, most of the infections are still concentrated in the metropolitan region here, over 500 in both Seoul and Gyeonggi-do province, more than 100 in Incheon, while the rest of the nation in most cases is seeing double-digit infections.
Right, and so authorities have shared their prevention guidelines for the weeks ahead, right?
Right, Sunny. Now, given that the autumn harvest holiday, or Chuseok, is coming up this month, the government decided that its social distancing measures coming into effect next Monday will have to be in effect for a period of 1 month rather than 2 weeks. And they will be extended at the current level. So let's take a closer look. That would mean level 4 in the metropolitan region and a few other places, while most of the rest of the nation will be under level 3. So that will be from September 6th until October 3rd. And the nationwide ban on private gatherings of 5 or more people in general remains in effect. And I'm saying in general because of this.
추석까지 전 국민의
70% of our nation's population will have gotten at least one dose before Chuseok, and around half will be fully vaccinated by the end of September. We have decided to partially ease some restrictions considering the vaccination process and the high level of public fatigue.
So basically, vaccine incentives. In places under level 3 or lower levels of social distancing, parties of up to 8 people can gather either at home or any public venues if they include at least 4 fully vaccinated people. Under level 4, gatherings can include up to 6 people if they include at least 2 fully vaccinated. But if that's not the case, past 6 p.m., the cap remains at 2 people. Operating hours at restaurants and cafes have been extended again from 9 to 10 p.m. over the financial struggles being faced by businesses. The government also reflected the difficulties of marrying couples and decided to allow up to 99 from the earlier 49 guests at weddings at level 3 and 4 social distancing if they do not serve food. Now, the government, meanwhile, also had specific announcements for a 7-day span, which includes the Chuseok holiday. Now, while authorities will embark on strengthened surveillance of prevention rules during the Chuseok holiday, the citizens can look forward to some additional relaxed measures, that is. So, beginning on September 17th, people in regions under level 4 social distancing can hold family gatherings of up to 8 people for a week if at least half of those members are fully vaccinated. Also, from September 13th, in-person visits to nursing hospitals and homes are permitted for 2 weeks if both patient and visitor are fully vaccinated. On trains, the government decided to stick to its earlier announcement of only selling window seats, while ferries can take up to 50% of capacity. More than a dozen temporary screening centers are set to be installed at rest areas or train stations. The government, meanwhile, is confident in reaching its goal of inoculating at least 70% of the population with 1 dose of COVID-19 vaccine. Currently, that percentage stands at 57.7%. Let's move on to some figures abroad. We are seeing 219.9 million people in the world infected with COVID-19 as of this Friday, noon Korea time, and on to some places with high increases on a daily basis. Here in the U.S., a six-digit figure of increases, followed by 45,000 infections in India in the past day and over 37,000 cases in the UK. And those are the updates I have for now. I'll see you back after the government briefing. Sunny?
All right, so thank you for now. Right, here in Korea, more than a dozen people were reportedly diagnosed with leukemia shortly after receiving their COVID-19 vaccines. Now, experts have ruled out a possible link between the two events. And for more, I have our Kim Sung-yeon here in the studio with me. Sung-yeon, welcome.
Good afternoon.
So, several petitions detailing these unfortunate events were uploaded on the Blue House website, I hear.
That's right, Sunny. So several petitions, they have been posted on the Cheongwade website by users claiming to be family members of people who had been diagnosed with leukemia shortly after getting vaccinated. Now, they called on the government to launch a thorough investigation and provide suitable compensation. Just 1 week ago, on August 27th, one user wrote that her fiancé, a man in his 30s living in Daegu, had been diagnosed with acute myeloid leukemia a month after receiving his first Pfizer dose. Now, according to another petition posted on the same day, a man in his 30s working as a taekwondo instructor in Daejeon had been diagnosed with the same condition after receiving a Janssen vaccine. Now, as of Thursday, there were a total of 16 petitions from users claiming that vaccines were to blame for acute leukemia. 9 of the cases involved Pfizer vaccines, 5 of them AstraZeneca, 1 from Moderna, and another one Janssen. So the complaints weren't limited to just one specific type of vaccine.
I see. And now, what are health experts saying?
Well, experts, they're saying that there are no documented cases anywhere in the world of vaccines leading to leukemia, and that it is highly unlikely that there is a causal link between the two. Let's take a listen.
At the present time, no evidence has been found in the US, Europe, and elsewhere of a causal link between the vaccines and leukemia.
The general consensus among experts is that acute leukemia cannot suddenly develop over the course of just a few days. Baek Sun-young, an honorary professor of medicine at the Catholic University of Korea, said that the country typically sees around 2,000 acute leukemia patients a year, and with over half of the nation's population now having received at least one vaccine dose, the leukemia diagnosis in people who were recently vaccinated may be coincidental rather than due to a cause and effect relationship.
Right, and this particular issue was addressed in detail by the KDCA during Thursday's briefing, Sung-yeon.
Certainly, the issue has been the talk of the town. So the KDCA shared its official stance in response to a question raised at Thursday's afternoon briefing on the possible link between vaccines and leukemia. Take a listen.
After consulting with the Korean Society of Hematology, we can tell you there is no evidence to suggest that COVID-19 vaccines can cause or trigger leukemia.
The KDCA said discussions with relevant authorities and experts have so far yielded no cause and effect relationships. The KDCA further explained that genetic factors aside, leukemia can be triggered by drugs and medication, but an individual would have to be exposed to the drug for several years for the condition to develop. Here's an expert's take on the matter.
We have come to the conclusion that it's theoretically impossible for acute myeloid leukemia to develop within just a few days or a few months of getting a vaccine.
Regardless, the KDCA and the Ministry of Food and Drug Safety stressed that they will continue to monitor and review all reports of suspected vaccine side effects and to examine the measures being taken elsewhere around the world in order to ensure the better safety of those getting the vaccines here at home.
Right, Sung-yeon, and against that backdrop, in the meantime, what do our viewers need to know about COVID-19 inoculation?
Right, so even though some do fear getting the vaccine, there is still a consensus among experts that the benefits of the vaccine continue to outweigh the risks and that there is no need to feel overly anxious. Now, some experts have added that avoiding vaccinations due to worries over adverse events is far more dangerous than the actual side effects themselves. So what we can tell our viewers is that although vaccines aren't 100% foolproof, getting one can significantly lower your chances of developing contracting a serious illness, even if you do catch COVID-19. So it is highly recommended that people do get their shots and continue to exercise prevention.
All right, Sang-Yeon, as always, thank you very much for the coverage.
Thank you for having me.
Right, up next, we bring you the regular afternoon briefing on the pandemic situation here in Korea for this Friday. Now, as Soa mentioned earlier, social restrictions under levels 4 and 3 have been extended nationwide starting next Monday until the 3rd of October. Again, there have been a few changes, though. Under level 4, as is the case here in the metropolitan region, dining and drinking establishments, including cafes, can accommodate patrons until 10 p.m. instead of the current 9 p.m. The briefing is about to start. We'll come back to you afterwards.
정례 브리핑 시작하도록 하겠습니다. 오늘은 장희창
Today we have
국립감염병
Mr. Chang
연구소장이
Hee-chang,
브리핑을
Director of
진행하겠습니다.
National Institute of
먼저
Infectious
장
Diseases.
소장의
For the
설명이
briefing,
있겠습니다.
first of all, here is Mr. Chang Hee-chang.
안녕하십니까. 9월 3일
Let us now begin our regular
코로나19
briefing
감염병
for
정례
September
브리핑을
3rd,
시작하겠습니다.
Friday.
우선 18에서 49세
As for
연령층
the
예약
vaccinations
변경 및 추가
for
예약 현황에
vaccine
대해
booking for the
말씀드리겠습니다.
people aged between 18
이미
and
접종받았거나
49, we
다른
have
대상군으로
seen
예약한
that
분들을
those,
고려하면
considering the
18에서
people have
40세
already been
청장 연령층의
vaccinated
접종률은
through other means,
대상 인구
we
대비
believe
약
that there would be
83.4%일 것으로
about
전망됩니다.
83.4% of this
해당
age
연령층의
bracket
접종은
getting their
8월
vaccines in the near
26일부터
future.
시작되어
And
9월
as
3일
for
0시 기준
this
약
age group,
102만
we
명이
have
1차 접종을
about
완료했고
1 million people
지자체 자율
receiving
접종,
their
우선 접종
COVID-19
대상군 및
vaccines.
잔여
And also
백신
we have some
접종
people
등을
signing up for the
18에서
surplus
49세
vaccines
연령층
and
전체
other
1차
means of
접종자는
the priority group
현재까지
vaccination
약
who
982만
have
명입니다.
already been inoculated, and we
18에서
see that
49세
about 9
연령층의
million people
사전
have already been
예약률은
inoculated.
69.4%입니다.
And as for the advanced reservation booking rate
9월
of this
18일
age group, it stands at
6시까지
about
예약이
64%.
가능하므로
And this
아직까지
age
예약을
group
하지
can
않으신
book
분은
their
서둘러 예약에
COVID-19
동참하여
vaccine
주시기를
appointments by the 18th of September. So please do make your booking
18에서
if you
49세
have not yet done so.
접종을
And
보다
as for
신속하게
the inoculation
추진하기
for this
추석
age group, in order to
연휴
speed
이전
up
2주간
the
예약
inoculation,
가능
we
인원을
are
확대
also
발표한 이후
expanding
9월
the people who
3일
can
0시
receive their
현재까지
vaccines
약
before Chuseok
116만
holiday.
명이
And we
접종
also have
일정을
about
앞당겼습니다.
1.16 million people who have
또한 같은 기간
also
신규 예약자도
rescheduled
약
their
37만
COVID-19
명
vaccination
늘어나 다수의
reservations.
청장
And we
연령층이
also have
명절을
many more
앞두고
people
빠른 접종을
receiving,
받고자 하는 것으로
wishing to
나타났습니다.
receive their COVID-19 vaccine before the
한편
upcoming
추석
Chuseok
연휴
holiday.
이전
Meanwhile,
일정으로의
before the
예약은
Chuseok
현재
holiday, this
마감되었으며
reservation
신규 예약
has been
또는
completed
예약
as of
변경은
now.
9월
And as
20일
for
월요일 이후로만
new
선택 가능한 점
reservations, you can
참고하시기
only
바랍니다.
book the COVID-19
9월
vaccination
6일부터
appointments for the
12일까지
days after
예약자의 대부분은
the
화이자
September
백신으로
20th.
접종받게 되나
And most of the people will
18에서
receive
49세
Pfizer
접종에
vaccines.
모더나
However,
백신을
we
투입함에
will
따라
also
현재
inject Moderna
모더나 백신
vaccines.
접종을
And
시행
currently,
중인
we have
의료기관에서는
hospitals that
모더나
are
백신과
giving out
함께
Moderna
사용하게
vaccines,
됩니다.
which will be giving out Moderna vaccines to the eligible
백신별 배송
recipients.
시기,
And
당일
by the
접종기관
supply
사정들에
of the
따라
COVID-19 vaccines
대상자별로
and
사전
also
안내된
for
것과
more
다른 종류의
schedules, we
백신으로
believe there
접종이
could be
시행될 수
some
있으니
changes to the
접종기관의
type of the
안내에 따라
vaccine. So
접종을
please be
받아주시기
notified
바랍니다.
by your respective vaccination
다음으로
centers
백신
or
도입 현황에
hospitals.
관해
And as for the
말씀드리겠습니다.
vaccine arrival here in
오늘
South
개별
Korea,
계약된 모더나
today we
백신
have
90만
Moderna
5천여
vaccines,
분이
about
인천공항에 도착했습니다.
900,000 COVID-19 doses,
이로써
vaccine
오늘
doses
도입된
arriving
모더나
in
백신을
Korea
포함하여
on this
9월
earlier
1일부터
today.
9월 3일까지
And also starting from the
513만
1st
회분의 백신이
of
공급되었으며
September until
누적
now, we have about 5.1
5,372만 회분의
million doses arriving here, and about
안정적인
more than
백신
50
공급을 위해
million
지속적으로
arriving here
제약사와
in South
긴밀히
Korea
협의해
in a
나갈
cumulative
예정이며
manner. And going
구체적인
forward, we will
공급
also
일정은
cooperate
제약사와
and
협의
have
등으로
detailed
신속하게
talks
안내드릴
with the
계획입니다.
drug makers, and we will reveal the details as
다음으로
soon as
신속한 백신
possible.
배송에 관해
And next, as for
말씀드리겠습니다.
swift vaccine delivery,
최근
we have some
가변적인 백신
updates.
도입 상황을
Right now,
고려하여
we have some
신속한 접종을
changes
위해
to the vaccine
10월까지
schedule, and by
배송 기간을
October,
단축
we
시행할
will be
계획입니다.
shortening the delivery
이를
time
위해
for the
백신
COVID-19
수송 차량을
vaccines.
확대하고
And to this end, we will
토요일
be
배송
expanding
시간을
the number of
기존
COVID-19
15시에서
vaccine
18시까지
vehicles,
연장하여
and we will
운영할
also
예정입니다.
extend the working hours
이와
so that we
관련
can
부득이하게
enable and
오후에도
ensure
보건소
swift
및 각
delivery.
의료기관에
And
백신
unfortunately, this
배송될
means
예정이어서
that we
위탁
could
의료기관에
have
양해를
COVID-19
구합니다.
vaccine doses arriving at local
접종기관
community
담당자는
centers and also
백신을
hospitals,
안전하게
even
수령하실
during
수
the week,
있도록
the
협조를
afternoons of
부탁드립니다.
specific days. We ask for your continued
다음으로 뮤
cooperation
변이의
and
국내 발생
understanding.
현황에 관해
And as for the Mu
말씀드리겠습니다.
variant, we we have some updates about the new variant here in South Korea. Actually, on the August 31st, the WHO that has added the new variant as a variant of interest. And to this end, the South Korean government has also carried out in-depth analysis. And right now, we have 3 variants of the new variant. All of them were imported cases. We had 0 local infections of the new variant. And including this new variant, we will be also intensifying, bolstering our quarantine and monitoring for the influx of the vaccines. And also from support of the COVID-19 vaccine development here in South Korea, we have some updates. The third trial by the SK Bioscience is being carried out right now. And this week, we also had the beginning of these administration to the patients and the subjects, that is, and we also will begin our overseas trial as well. And to this end, we will also make sure to develop a homegrown vaccine here in South Korea as soon as possible. And as for all of the subjects that are participating in the third trial, we are providing all of the incentives and support. And as for their COVID-19, the vaccination trial, we will be also carrying out the analysis of the neutralizing antibody, and this can only be carried out at BL3 grade level laboratories. And we will be carrying out about 12,000 analyses going forward. And we will also cooperate with a major public and private, as well as the international agencies when it comes to such analysis. And aside from this, we will also cooperate fully with about the DNA COVID-19 vaccine development here in South Korea. And this includes ST Farms. And also, we are also thinking about the next generation COVID-19 vaccines. And we will also be providing support for these R&D processes as well. And we also have a separate TF team to support this. And we are also cooperating fully with Moderna company. And we will also expedite our process in developing an mRNA vaccine here in South Korea. And because these pills of the COVID-19 treatments, we are also going to develop such therapeutics as well. And here in South Korea, we have the COVID block, as well as other kinds of drugs that have been completing the clinical trial stages here in South Korea. And we have the remdesivir COVID block, as well as a number of other drugs that are currently administered to critically ill patients. And we have more than 166 patients that are participating in this study. And we also have overseas other drugs that are developed by Pfizer and a number of other drug makers as well that are currently carrying out the clinical trials. And going forward, we will be monitoring of the trends of the development here at home and abroad as well. And as for the COVID-19 new variant cultivation, we have some updates. And currently here in South Korea, we have about 889 samples being cultivated across 71 institutions, and most of them were about 580 or so, or for the further analysis, in-depth analysis. And we have the most proportion accounting for the Delta variant. And as for the major variants, we have about 440 being cultivated right now. And as for the other variants, we also have numerous others. And going forward, we will also provide proactively the information on such new variants so that we can contribute to the development of and the research of these sectors. And if you are in need of such inquiries, please also make your inquiry to our institution. And as for the administration of the COVID-19 drug remdesivir, it has been administered to more than 13,000 patients here in South Korea. And the regular treatment here right now has been administered to more than 12,000 patients here in South Korea. And also we have about 48 cases of the anti-plasma treatment that is also being administered here in South Korea as well. And we believe that we were able to contain the virus to a large extent thanks to your participation. And we are seeing a fourth wave continuing for a very long time, fueled by the very contagious Delta variant, and I am confident that we will overcome the fourth wave as we just did with the three previous waves. And it is very important that we continue to get our vaccination going forward, and we need to also muster our strength at this specific moment. So please take part in the vaccination rollout and also refrain from having group gatherings, wear your face masks, and also comply with the quarantine measures. And the quarantine authorities will also make sure we provide any prevention measures going forward. Thank you very much.
지금부터 기자님들 질문에 답변 드리는 시간 갖겠습니다.
Right, that was Chang Hee-chang with Friday's afternoon briefing, and I have Soa here back at the desk with a summary of his address. Right, Soa?
Right, Sunny. Let's start on the vaccination process here in the country, as inoculations for regular citizens aged 18 to 49 is smoothly underway. According to Chang, 1.16 million people have rescheduled their vaccinations to before the Chuseok holiday as part of the government's expansion of people that should be inoculated before the Chuseok holiday. And in the near future, those who are going to get their vaccines from September 6th until 12th are mainly going to receive Pfizer shots, but there will be a few exceptions with people receiving Moderna shots because we had recently many doses coming into the country. And following rising concerns abroad over a new variant of interest, the variant Mu, the government is bolstering its monitoring of that variant here in the country and has found 3 imported cases, but so far no local transmissions.
I see. All right, so as always, thank you very much for that.
My pleasure.
Another heartbreaking phenomenon of the pandemic is perhaps the plight of children who have been rendered vulnerable to various risks arising from the inability to access proper education, peer interaction, and in some cases even simple protection. Now, for more on this, here in the studio, I have Oh Jun, former ambassador to the UN and current chair of Save the Children Korea. Pleasure to have you with us again, Mr. Oh.
Thank you for having me.
I also have Professor Chung Seon-jae from Yonsei University. It's been a while, Professor Chung.
Thank you for having me again.
Right, and joining the session virtually is Professor Lorraine Sher at University College London. It's good to have you with us, Professor Sher.
Hi, lovely to be with you.
Right. Now, Mr. O, we'll start here in the studio then. COVID-19 has been taking a toll on children as well. Perhaps we can start with a bit about their plight amid the pandemic.
Well, the United Nations has already declared the current situation as one of the worst child rights crises in history. Actually, as we all know, all over the world, the COVID-19 pandemic crisis has been driving humanity into the worst humanitarian crisis of our time. And the negative impact is particularly harsh on the vulnerable groups in our society, which of course include children who often become silent victims. Children's access to food, access to education, access to health care has been seriously disrupted in many countries, including both developed and developing countries. And this is time for all of us to think seriously about it and think about our future.
Right. Now, back in November, you were with us talking about the violations of children's rights in the wake of the pandemic. Have there been any improvements there since then?
Unfortunately, there has not been much of change in that area. Save the Children conducted a survey in 37 countries, and they came up with a report called Protect a Generation. And this report reveals that the pandemic crisis has widened existing inequalities all over the world, and there is a serious child protection crisis. For example, if children are sick with diseases other than COVID-19, such as malaria or malnutrition, they cannot get access to medical treatment very often because the hospitals are overwhelmed by COVID cases.
Right. Professor Chung, what do you believe then has been the most severe repercussion of COVID-19 on the daily lives of children?
Well, actually, when limited to Korean children, I think the most serious change on children's mental health is the reduction of quantity and quality of the social relationship with peers and teachers, I think. Actually, the school does not only give the knowledge or the intellectual knowledge alone, but it also teaches the children to take responsibility for social norms and also to adjust to the dynamics through social activities and also to cope with the various social situations. And this kind of all interactions gather to make the brain development at that very young age. And if I'm very suspicious that this kind of other positive stimuli other than this kind of intellectual knowledge can be given or replaced online, and this will inhibit children's early brain and social development.
Right, unfortunately. And meanwhile, Professor Sher, what can you tell us about the plight of children in England amid efforts to contain the pandemic there?
Well, I think it's a very global situation with very much the same type of challenges. Our particular research has looked specifically at orphanhood and the loss of caregiver or key caregivers such as grandparents. And our model that we just published in The Lancet would suggest that about 9,000 children in the UK have suffered from such orphanhood challenges. And we see this as a global situation. The children went back to school in the UK yesterday, and our schools are open and pretty low on the restrictions as we've evolved and moved into a different phase of the pandemic, probably due to the enormous and fairly successful rollout of vaccines. So the situation in the UK is probably somewhat different to low and middle income countries where resources are still constrained, and depending on the state of the pandemic where people are caught.
Right. Back here in Korea, Mr. Oh, the Health and Welfare Ministry says child abuse in the country rose by almost 3% last year, and 82% of the abusers were parents. Now, do you believe social restrictions to stem the pandemic have perhaps exposed children further to the possibility of violence within their homes?
Yes, I think so. That's what worries many people in the child protection organizations like Save the Children. And actually there have been different reports on child abuses. Some have seen a rise in abuses, in number of abuses, some a decrease. But even if there is reports that reveals a decrease in child abuse reports, that is not a source of satisfaction, because that could be a sign, a dangerous sign, because that could mean that usual child abuse whistleblowers like teachers and caregivers, they are not working properly. So that's why we are seeing a decrease in reported child abuses. That could be the case. So that's also dangerous. And at the same time, in countries like Korea, South Korea, children are more exposed to online. They consume more time online and exposed to online media, and that also increased the risk of online abuses and online crimes as well. In developing countries, there is a huge interruption in children's education. Nearly 300 million children all over the world are still having difficulty in getting back to school, so their education is being disrupted, and probably over 10 million of them might never go back to school, according to certain reports. So that should be a source of great concern for all of us.
Right, those are some grave numbers there. Professor Sharon, now as you mentioned, you were part of a research team that disclosed findings on pandemic-associated orphanhood, which I mentioned at the start of the program. Could you tell us a bit more about your findings?
Well, our findings really point to the fact that children are not central to the response, and they really are somewhat under the radar. We look particularly at how countries calculate and report their pandemic numbers, yet children seem to be somewhat neglected. And if you neglect them and you don't count them, the problem is that you don't provide services. As the colleague from Save the Children points out, many things happen, like the increasing of abuse and access to education gets disrupted. So we found that over 1.5 million children at this point have been impacted by parental loss or caregiver loss. And we feel that this is quite a dramatic and global crisis. We know from previous pandemics, such as HIV or Ebola or SARS, that the impacts are lifelong and that the care needs are dramatic and need to be seen to very quickly. And very few countries, if any, are actually creating proper policies and proper provision for these children. We know that they need assistance very quick. We know that family care and family type of care is the best possible for these children, and that provides an urgent challenge to the family at the time of bereavement to look at the care provision for these children.
Right, which is not being taken care of properly then. There is no care provision for these children in the absence of their parents, Professor Sher.
Yes, we've seen in certain countries when the parent dies, the children would still be living in a family where COVID had been prevalent, and some of them need to go into isolation for a week, and some of the families, the children are left alone for that week. And then we see the need for very urgent provision.
Right. Professor Chung, what can you share with us about the general psychological impact of the pandemic on children?
Well, actually, foremost, like the Professor Sher said, I think we have to be concerned first about the children who are isolated or quarantined. And from the report, they show the higher prevalence of acute stress disorder, adjustment disorder, and grief. And also the reports say that 30% of these children exhibit the symptoms of PTSD. And by the perspective, they would have the higher prevalence of mood disorder, psychosis, or suicide when they grow old. And for the general children population, like the Mr. Oh Jun said before, the results are right now conflicting. Well, most of the times, most of the data say they have seen that the adverse effect of the mental health by the COVID-19. However, some data said they didn't observe that much difference between before and after the COVID-19. Well, from our own data analysis from the Korean Youth Risk Behavior Web-based survey, which we surveyed about the adolescent aged more than 14 years, actually we've seen some improvement of this mental health indices for the depression and suicidal thought between the September to November 2020. However, we don't think this is permanent because it has the longer effect about this time, about this COVID-19 effect. And I think there are some great chance to bounce back about this situation, about mental health. And they can bounce back to more adverse, higher depression, higher suicidal thought, because now it's getting long period of COVID-19 exposure. So we are worried about that situation.
Right, it is a prolonged pandemic right now. Professor Zhang, despite the importance of in-depth understanding of the mental toll of the pandemic itself on children, I understand research has faced restrictions in this area. Could you explain this for us?
Well, actually, I think the biggest limitation about the current research is that now we have shortage of the large-scale representative data with the longer follow-up. So actually, this is children, and this is like you have to make a survey on specific area of the school, or make a very limited source of the assessment. And it's also challenging to give kind of a comprehensive view from this kind of data. So as for maybe the solution, I think the linkage between survey results and large-scale national administered data can be one hint for this. And I think we should keep in mind that there are some shortage of the data regarding the children under 10 years old, and they are showing the greatest brain development, and I think they're the most important ones. But we have lack of data right now, so more data should be gathered by that kind of situations. And also, maybe the multi-level structure assessment is needed because we need interpretation by the individual, community, and the national level.
Right. Mr. O, let's now turn to the possible measures to address the challenges faced by children. What is your entity, Save the Children Korea, seeking to do to better address the hardships faced by children amid the pandemic?
Well, Save the Children has already launched campaigns like Save Our Education, Save Back to School. So these are some of our new campaigns. And as I mentioned earlier, education disruption is a huge problem for all of us. Maybe in countries like South Korea, we might have been a little luckier than others because we have quite good IT technology and remote education technology that has been used for children who had to stay out of school. But in many developing countries, they do not have that technology, and children just have to, suffer, endure all these problems of, disruption in their learning. So once things go back to normalcy, we need to take care of these huge effects or aftermath of this crisis. There is a window for everything, especially for education. So if you lost window is gone. It's very hard to make up for that. So in that sense, Save the Children is trying to work with the governments and also different segments of society, so that once this is over, we can go back to normalcy, we can go back to education as it should have been.
Hopefully in the near future.
Yeah.
Professor Sher, what support framework, and I understand this would be a difficult question, but what support framework do you propose for children who've lost their caregivers?
So we have thought quite carefully about a framework, and we really see a three-pronged framework where we call it prevent, prepare, and protect. And I think if governments could focus on these three platforms, a lot of progress could be made. Preventing the loss of a parent or child exposure to any harms, as you've heard from your other speakers on the program, would be crucial. So keeping children central in all policy decisions, working out about school, keeping an eye on violence, and also a really important point is to understand that there is something of youth agency, and there is positive mental health as well. And we're certainly seeing it, and you'll see Dr. Young's data shows some mental health improvements as well. Bear that in mind. Children are resilient, and children have enormous resources. prepare, well, we think that there's a lot of preparation that can be done, and protect. We need to avoid the mushrooming of orphanage care and large institutions. We know these are bad for children, and for orphaned children, we certainly need to propose good quality family care. And if there is no family available, then having family-style alternatives like foster care or adoption is really very important. And trying to make up for the losses, understanding the disruption of education, the disruption of services, and how you can help children. And I think we need to be keeping a very special eye on violence, because as has been said on the program already, and this is true globally, there is an increase in violence, and children are specifically and particularly vulnerable.
Right, they are. Professor Zhang, given the concerns raised by Ambassador Oh, what do you believe that is, that the gradual expansion of in-person classes within the local academic arena will perhaps offer the children a better sense of stability amid the pandemic?
Of course, of course. Regarding the mental health, I think it's going back to school and give the face-to-face relationship. I think they will really benefit the children who have suffered from daily boredom and lack of direct interaction with their colleagues, or the children who had suffered from distress due to insufficient personal space at home. And also, in addition, I think that could be a partial shelter for children who has been exposed to domestic violence. And also, going to school regularly will build the children's regular healthy lifestyle, which can prevent the irregular sleep, low physical activity, and excess media use.
Right. And Professor Shah, you spoke about the importance of preventing, preparing and protecting. Do authorities in England have specific measures then to perhaps support children amid COVID-19?
I think authorities in the UK and globally really haven't yet come up with very specific and comprehensive measures for children. Ideally, the measures that exist can be adapted and utilized, but I don't think anywhere in the world we have really fine examples of excellent programs for children. So I really think this is an urgent and bubbling problem. Professor Young spoke about returning to school as a big step forward, and I certainly agree. But then there's a large number of children who are out of school. We know studies from Kenya, for example, where the return to school, there's some children, especially girls, who have not returned when return comes and may never return. So I think we have to look at the sort of tail end of the pandemic, which brings with it very many challenges and harshness to children. And these are lifelong impacts. And there's a kind of cascade of effect where you miss one opportunity and subsequently there are many, many more problems. So I think the time to act is now. And I think governments need to wake up. They've been very focused on the biomedical, of course, people looking about life and treatments and vaccines and oxygen supply, but there's more, there's very much more. And I think if we don't focus on the children and their needs, we'll have a lot to pay for in the long term.
Right, we will. And against the concerns raised by Professor Sher, Mr. O, what do you suggest to better balance the need or efforts to ensure public health amid the pandemic with the needs to protect the interests of children across the globe?
Another thing I think we should pay more attention to is the burden of parents and caregivers as well. You know, during the pandemic, children were mostly at home, so the burden was very big. That probably explains part of the hike in child abuses. So now, when we go back to our life and children go back to school, I think we need a kind of whole of society approach to deal with the aftermath of the pandemic. You know, we should try to limit the negative impact, long-term negative impacts from the pandemic on our future. we should not let what we have been missing during these difficult times become a curse on our future generation. So that's, I think, we should be doing.
Right, Mr. Oh, thank you very much for those words of wisdom and for your time today. Professor Zhang, thank you very much for your insights. And Professor Sher over in London at this very early hour, thank you for being with us live.
A wonderful pleasure and an important issue.
Right. Well, that ends our coverage for this week. We'll be back with more pandemic-related news next Monday. See you then, and do take care.